Hello and welcome. Today, we're diving deep into a fascinating and often misunderstood condition, Graves' disease. It's a thyroid disorder with significant impact on the nervous system and overall health. Join us as we explore its cause effects, diagnosis, and treatment options. So, what exactly causes Graves' disease? The simple answer is it's an autoimmune disorder. That means your immune system, which is supposed to protect you from invaders like bacteria and viruses, mistakenly attacks your own body. In Graves' disease, the immune system produces antibodies called thyroid-stimulating immunoglobulins, or TSI. These antibodies bind to receptors on thyroid cells, essentially mimicking thyroid-stimulating hormone, or TSH. Genetics also play a significant role. If you have a family history of thyroid disease or other autoimmune conditions, you are at a higher risk. Environmental factors like stress, smoking, and certain infections can also trigger the disease in susceptible individuals. Now let's talk about the pathophysiology, what's actually happening inside your body. As those TSIs bind to thyroid cells, they trick the thyroid into producing excessive amounts of thyroid hormones, specifically thyroxine T4 and triiodothyronine, T3. This overproduction leads to hyperthyroidism, a state where your metabolism goes into overdrive. The excess thyroid hormones affect nearly every organ system in the body. The nervous system, in particular, becomes hyperexcitable, leading to a range of neurological and psychological symptoms. The heart also works harder, and bone turnover increases, potentially leading to osteoporosis. Let's consider how common Graves' disease is. Epidemiology studies show that it's the most common cause of hyperthyroidism in the United States and worldwide. Women are significantly more likely to develop Graves' disease than men, with onset typically occurring between the ages of 20 and 50. While anyone can get it, certain ethnic groups, like Caucasians, have a higher prevalence. It's important to remember that these are just general trends, and anyone experiencing symptoms should consult a healthcare professional. Graves' disease manifests itself in a variety of ways. Some of the most common signs and symptoms include anxiety, irritability, and difficulty concentrating. You might also experience heat intolerance, increased sweating, and weight loss despite a normal or even increased appetite. Tremors, particularly in the hands, are also common, as is a rapid or irregular heartbeat. One of the most distinctive features of Graves' disease is Graves' ophthalmopathy, which affects the eyes, causing bulging eyes, double vision, and eye pain. Goiter, an enlargement of the thyroid gland, is another frequent symptom. Not everyone experiences all of these symptoms, and the severity can vary greatly from person to person. Diagnosing Graves' disease typically involves a combination of physical examination, blood tests, and imaging studies. During a physical exam, your doctor will look for signs like goiter, bulging eyes, and tremors. Blood tests are crucial to measure levels of Th4 and T3. In Graves' disease, TSH levels are usually very low, while T4 and T3 levels are elevated. Blood tests can also detect the presence of thyroid-stimulating immunoglobulins. A radioactive iodine uptake scan can help determine if the thyroid gland is overactive and rule out other causes of hyperthyroidism. While we don't categorize Graves' disease into strict subtypes, it's important to recognize the varying degrees of severity and the presence or absence of Graves' ophthalmopathy. Some individuals might have mild hyperthyroidism with minimal symptoms, while others experience severe hyperthyroidism with significant complications. The presence and severity of eye symptoms is also a major factor in determining the overall management strategy. Fortunately, there are several effective treatment options for Graves' disease. The primary goals of treatment are to reduce thyroid hormone levels and relieve symptoms. Antithyroid medications, such as methimazole and propylthyrosol, a PTU, can block the thyroid's ability to produce hormones. Radioactive iodine therapy involves swallowing a capsule or liquid containing radioactive iodine, which destroys thyroid cells. Surgery, specifically thyroidectomy, which involves removing all or part of the thyroid gland, is another option. Beta blockers can help manage symptoms like rapid heartbeat and tremors. The best treatment option depends on the individual's age, health, severity of the disease, and personal preferences. Management also involves regular monitoring of thyroid hormone levels and adjustments to medication as needed. Unfortunately, there's no guaranteed way to prevent Graves' disease, given its autoimmune nature. However, there are some lifestyle modifications that may reduce your risk. Avoiding smoking is crucial, as it's a known risk factor. Managing stress levels through relaxation techniques like yoga or meditation can also be beneficial. If you have a family history of thyroid disease, be sure to inform your doctor and undergo regular thyroid screenings. The prognosis for Graves' disease is generally good with proper treatment. Most people can achieve remission or effectively manage their symptoms. However, it's important to understand that Graves' disease is a chronic condition and relapse is possible. Regular follow-up appointments with your doctor are essential to monitor your thyroid hormone levels and adjust treatment as needed. Recent research focuses on developing more targeted therapies that can specifically suppress the autoimmune response without causing widespread side effects. Scientists are also exploring the role of genetics and environmental factors in the development of Graves' disease, with the goal of identifying individuals at high risk and developing preventative strategies. Ultimately, understanding and effectively managing Graves' disease can significantly improve quality of life.